Thanks, Christy, and thanks so much to the whole SEER team for organising this and all the support that we have. And thanks so much to everyone joining for your interest. We're very excited to share a very fresh case study with you of portfolio impact measurement from Future Generation Global. And we've all been working on this together since 2022. And also with our 13 other nonprofit partners, as well as Zoe's organisation, Social Outcomes and SEER. And we just released our first impact report, so we're excited to be able to talk about how we got there. I'm going to start with why we would do impact measurement, because obviously it's not a straightforward thing to do, even if you're one organisation, let alone at that portfolio level when a funder or a collaborative group is trying to understand the impact of a range of different non-profit partners who do different things with different participants. And it definitely requires willingness, time, and data systems from non-profits. So I'd like to shout out to our partners, our 14 partners, as Chrissy already has, who have really taken on board that challenge of accountability for impact. Thanks, Angus. We're good there. So why would we measure? Well, Future Generation runs two investment companies that are listed on the stock exchange, and they generate both financial return for shareholders, as you'd expect, but they also generate a stream of donations for Australian non-profits. So if someone invests in Future Generation, which anyone can with $500, their money is invested with more than 30 different fund managers, and those managers manage that money without charging any of their usual fees. So they're doing it on a pro bono basis. And with the savings that we make by not paying any fees, the companies donate 1% of their assets each year to nonprofits. So we have about $1.1 billion under management from about 15,000 different shareholders from all over the country. They're mostly mum and dad investors. And since we started almost 10 years ago, we've donated more than $87 million. So I guess the first reason why we would measure impact is to have accountability and show transparency to all those thousands of contributors who make the community impact of Future Generation possible. And, it's a virtuous cycle, because the more of them we have, the more money that we have in the pot that we can invest into the community. Secondly, as an investment vehicle, as you'd expect, there's a lot of rigor and infrastructure on the finances. And while we can't boil social impact down to a monthly performance figure, we wanted to bring a more systematic approach to our social investment side that would help us better understand our impact, better be able to tell that story, and also to be able to learn about what's working, what needs tweaking, so we can improve our approach and our outcomes. And thirdly, and most importantly, we're really, really focused on having an impact in youth mental health, and especially in prevention. We see our ultimate accountability as being to young Australians, and that's in our governing documents. And no other group of health conditions comes close to mental health in terms of the prevalence, persistence, and breadth of harm that it inflicts on young people. And, we're in a situation where we've had decades of reform in mental health care, decades of increasing government funding, but we're not seeing any change in the surge in mental health conditions among young people. And on the world stage, we're recognised as a leader in the treatment of youth mental health conditions. And despite prevention being acknowledged as a focus and priority for government since the 90s, we haven't actually turned our policy focus or our public resources to it. So of the approximate $12 billion annually spent by governments on mental health, only around 1% goes to prevention. So if we don't change that human cost that we're already seeing, and the financial cost, which escalates each year, is only going to continue on that trajectory. So Future Generation is really got its sights set on prevention for all those reasons. And if we're going to succeed in that, we have to gather data about its impact, because one of the first things people say is, oh, but prevention, you can't measure that. Thanks, Angus. We obviously believe that you can, and our collaborative believes that you can. So prevention work centres on boosting the protective factors and reducing the risk factors for mental health. And lots of these are very well known and certainly measurable. And while we know there's not one silver bullet that we can sort of let loose that can change that trajectory of youth mental health, we've taken a portfolio approach to invest in 14 nonprofits that do different work and collectively span the wellbeing and prevention spectrum that you can see there. So our partners are complementary in that they're working towards that same overarching goal of wellbeing and prevention for young people, but they're getting there in different ways and with different young people. So their work ranges from arts-based programs to outdoor adventure initiatives, from mental fitness and resilience building to bringing young people and animals together. But they're collectively modifying those risk and protective factors in three main ways. Firstly, they're equipping young people with knowledge, with skills and confidence that they need to look after their mental health, and by providing them opportunities to build self-esteem, to connect with peers, and experience a sense of purpose and accomplishment. Secondly, they're providing the key adults in young people's lives, such as parents and teachers, with the skills that they need to promote positive youth development. And finally, by creating mentally healthy environments, whether that's at home, school, work, community, and of course online, that are free from racism, bullying, discrimination, and other factors that we know harm mental health. We're also trying to drive impact in the way we fund. So we provide partners with multi-year untied funding, as well as additional capacity building support as a way to try and accelerate their impact. And then, of course, we're gathering the data to measure that. Thanks, Angus. So how do we measure? Well, we use a theory of change as the framework for impact measurement, and ours was developed by Social Outcomes, and it was designed around the work of our partner organisations and the evidence that was available in the public domain about what works to safeguard wellbeing and prevent mental ill health. And the brief for that work that we gave to Sandy and her team was that it needed to traverse the diversity of our partners' work, complementary but different. It had to be useful to us to track the impact of the portfolio in a way that we could communicate with our stakeholders. And it had to be accessible for all partners to be able to participate, because across the group, there's a whole different range of approaches to data and measurement, and there are different levels of data maturity. It also needed to capture 3 different levels. So the main body is our partners' work in prevention and wellbeing, which you'll probably be able to see illegibly on a slide at some points, very small writing. And then secondly, the partners' capacity building side. And then thirdly, Future Generation Global's own work, which really is around convening, communication, measurement, and youth participation.
Sandy, so this was a very big brief.
It was.
And it was also the first time, really, that any organisation had attempted a portfolio approach. So from your perspective as the architect, what were the tensions? What did you have to think through? It would be great to hear your perspective from, the question of how do we do this?
Yeah. So I was thinking earlier this morning, how many measurement frameworks have we done? And my colleague Vanessa is on the line. I don't know if she has a view, but like a lot. we've lost track of how many that we've designed, and we've got used to, you know, it getting into a rhythm around how we do that, evidence-based, and digging into the detail and having, yeah, Vanessa, lots and lots. And making sure that it's simple enough to implement. A lot of measurement frameworks suggest that you measure everything that moves, and we're of the view that you measure as little as possible. So you work out who's the audience for that measurement and what do they need to know, what must they know in order to make a decision or whatever it is they're going to do with that information, but no more than that. So we don't need to measure absolutely everything because it just places a burden. When we approach this work, it was the most challenging piece that we've done because we were thinking about 14 organisations and we didn't know who they were at the time. So that was particularly challenging. So we had, where were we, Emily? Long list, medium list when we started designing. I can't quite remember, but we had at
Probably
least
about medium list,
30.
probably 45
Yeah.
organisation.
We were looking at the themes. There were some that had been funded before, so we were referring to that, but mostly we were having a look at the long list and at things that were common and not common in that long list. And what was very clear is we had lots of different organisations. Whilst they were working in that same general impact domain, they were doing it in very different ways with very different cohorts. We were able to group them a little bit in terms of how they were creating impact, but then there was another layer of complexity in that some had quite sophisticated measurement processes already in place. Others had absolutely none, and they're really tiny and under-resourced. And so we had to accommodate for everything. So what we decided to do was a build your own adventure. So for those organisations that had a sophisticated process in place already, the larger ones, they could say, okay, because we allowed people to build a theory of change if they didn't have one, as well as a measurement framework that went with that theory of change. And they could say, well, we're an organisation that does this thing, therefore these 3 outcomes are open to us, these activities and so on and so on. So they could start to find themselves in the framework. And they could say, well, if I'm already measuring something, we're going to put our tool in there, but the outcomes are similar. And if they didn't have one, then they could choose from a few tools that we gave them, some a little bit more sophisticated, others less sophisticated, depending on how they wanted to go, but they would do their thing. So we tried to introduce enough flexibility to meet the needs of both the 14 partners and Future Gen Global as that got rolled up into a portfolio, but not too much flexibility so that we'd have 14 completely different things coming out the other end that you could never roll up into a portfolio thing. So did we do it really well? Oh, I don't know, because it was the first time. I think we could always do things better. And one of the things, the feedback that we've got from the 14 partners is perhaps too much flexibility. So we're now designing another portfolio measurement framework. And so we will reduce the flexibility a little bit, be a little bit more directive in terms of how that plays out. So that was an interesting learning. But yeah, we can hear from Zoe as to what she thought. She can rip into me if she wants. That's fine.
We will hear from Zoe in a minute. Unless Zoe, you want to jump in, feel free.
I'm not going to rip into you, Sandy.
Oh, all right. There's the fun in that.
I think we got the benefit of the flexibility, and I can talk to a little bit of that later when I talk about our experience. You know, we got the benefit of being able to kind of see ourselves in the framework, and then being able to actually kind of go, okay, but these are the things that we've missed when we've done partnerships before that we really want to highlight in our story and the journey that our participants take.
And I think that has been one of the really great pieces around the co-design of this as well with each of the partners, which we'll get to in a minute. Sandy, I'm curious about your perspective on still evidence-based, but not an academic approach. Do you want to talk about that a little bit more, what that means to practically make this work?
So as practitioners in this space, so we're not academics, we're practitioners of social change, we think about how is the organisation going to use this. So they're not going to use it to publish papers. They're going to use it hopefully to attract funding, because we're seeing more and more now, every government department and every philanthropic funder says, do you have a theory of change and a measurement framework? And if you don't, they might help you to get that, but they're asking that question. And so we very much see it for its value in a few layers. So one is transactional. And we are seeing this when we work with clients and they put in a measurement framework and they start reporting on that. they attract more funding. So that's the good news. But what I said before is work out just enough. So what does government want to know? What does philanthropy want to know? What do the general public want to know about your organisation and about its impact? So it doesn't need to be a randomised control trial, in our opinion. It doesn't need to be that complicated. There's a few pieces of data that are material that they need to know. Are you doing these things? And the big boulders that really matter. And everything else is more for your insight generation, but it doesn't show up in the impact report. They only need to know certain big things in terms of, are you doing what you said you would do? And all the detail that sits underneath that folds back into the organisation so that the organisation can reflect on how to increase the impact in future. So it's always got the communication angle and the transactional angle, and as well as the insights back to the organisation, what they can learn to improve their practice. So we think about it really pragmatically. We do as little as possible. We try and understand the impact area as deeply as we can, the organisational response to that as deeply as we can, and then simplify it right down. Choose tools that are free, short, easy to implement, and ones that don't feel like a medical exam for the person who's filling it out. So we use those kinds of principles to make sure that it's practical but robust enough, but no more than it needs to be.
And so in this case, because of the number of partners and the complexity at the outset, you talked about a little bit more about, making it simpler, with rigor without complexity.
Yeah.
Do you want to just expand on that a little bit more? Because, of course, there are a number of people here who might be thinking about portfolio-based impact measurement, but a number of not-for-profits who are thinking about, well, how do we gather data to tell our impact story with rigor, yet without complexity?
Yeah. So when we start a process, forget it being a portfolio or not at the moment, we always start with looking at the evidence base. So we know what the evidence says works and doesn't work. And then we feed that into a workshop with the organisation, with partners, whatever it might be, and develop a theory of change. We couldn't do that in this instance because we didn't know who the partners were when we were doing it, but that's our normal approach. So the theory of change is the absolute foundation of what you do, and not a theory of change that's enormously complex, but one that's like a plan on a page that expresses really simply what you do. And that we do that with the organisation. They draft it up with our help, but it's theirs. And then that becomes a living document that evolves over time. But the theory of change is like a 50-year strategy. So over the next 50 years, what do we hope to be able to achieve? And each strategic document, each strategic plan falls out in like underneath as a slice of that theory of change. But having a simple but evidence-based theory of change then allows you to say, okay, if those are the outcomes we get to in the medium and longer term, what few things can we measure out of that? And so really keeping that simple. But if you are overly complex with your theory of change, then your measurement framework becomes overly complex. So it's really getting a nice, tight, clear, simple theory of change that allows you to have that same simplicity as you then attach the measurement frameworks to the outcomes that you've expressed in your theory of change. And when you're rolling that up for a portfolio, you're looking for commonalities. So we tried, as we got from the medium list to the short list to the final 14 partners, we kept reflecting in terms of what do they have in common and what do they have that's different. So how can we push people down this avenue to get to the outcomes that would accrue from that approach versus this avenue, depending on what it is they do. So we kept trying to group them by how they engage with the clients, who their clients were at what stage, but also the kind of work they were doing with clients. Were they doing policy work? Were they doing some kind of direct intervention, et cetera, et cetera? So that guided them to think through, well, we fit here. And so we can follow that stream of outcomes to those simple measures out the other side.
Fantastic. Thank you, Sandy. And thank you everyone for your questions. Great questions. We're going to show you some of the dashboards in a moment. Angus will bring them up. But firstly, and we'll answer those questions at the end. But firstly, before we do, back to you, Emily, on the next part, the how.
Thank you. So I guess the next task from when Sandy and her team were able to define that theory of change that could encompass all the partners and the impact measurement framework, which set out, how the process of measurement would occur. We had to find a tech platform that could then operationalize that. It was certainly too complicated for an Excel way to manage. So we needed to find a platform, and it had to be able to accept and hold the data from all the partners. It had to be able to analyze it, aggregate it, and visualize it. And we couldn't actually find any software that was ready off the shelf at all. And even some organizations we approached who we thought might be able to help, once that sort of aggregation penny dropped, what we wanted to do, they sort of said, oh, we can't do that yet, or we're not sure how to do that, or we'd have to have other expertise to do that. So we felt very lucky that SIA was up for it, and we have worked together to build as we go. And now our impact measurement is operationalized on the SIA platform in a way that tracks each partner's individual progress, and also tracks the reach and beginning to track the impact of the portfolio as a whole. So we request 3 different types of data into the platform. Firstly, partner organizations data, which includes their aims and their targets for their partnership with us, relating to both their impact and also their organizational development. Also, financial information at the organization level. The second bucket is demographic and participation data about the young people and other stakeholders who partners work with. And then finally, the third bucket of data are the outcomes for those young people and stakeholders as a result of their participation in the partners' activities. And of course, this is the real work of impact measurement, trying to understand the change in those people's lives as a result. And so after our first year of collecting outcomes data in 2023, all the partners had between them 73 different metrics that demonstrated progress against the 12 short-term outcomes that we had in our theory of change.
Emily, can I just explain one word on this slide, which is gateway?
Yep,
So
go for it, yep.
we had those 4. So when we were trying to group the 14 partners in terms of categories of what they do, awareness and promotion, fairly obvious, prevention, fairly obvious, advocacy and capacity building. But the gateway is the idea that people who have severe mental health concerns, so much so that they're very homebound. And so it's very difficult for them to engage with anything. So you could say, well, come to our program and we'll get you back to work or whatever. It's too big a leap. So there are a number of organizations that we've seen in our work, that including Paws Happy Hearts, that play this absolutely critical gateway function. That is the joiner, if you like, between someone who's housebound and someone who's out participating in the community, in work, in education, all of those things. And the gateway allows them to take a small tentative step out into the world in a very safe and secure environment and build confidence, courage, social connections, new skills, all those things until they're ready to then step onto the next thing. So a bunch of organizations work at that gateway level between those 2 places before they're ready to do anything more significant in terms of taking on issues in their life. So it's an incredibly important role that they play, and often one that's missed, particularly in government funding, is you think you can go from really being socially isolated straight back into the workforce with a CB workshop. It's just not true. There's a lot of work, and Zoe and the team can sometimes work with an individual for a couple of years to get them to be confident enough to take control and have that agency over their own lives that we're seeing. So that's what the gateway word means.
Thank you. Oh, there we go. So the mechanics of how it actually happens. So Sandy alluded to this, but each partner chooses their own path through this theory of change that you can see by selecting the outcomes that best reflect their work. And for each outcome selected, they nominate the metric and source for the data that they'll provide. Then each partner collects that information from their participants in whatever way they normally do, or in their usual way. and then they upload de-identified data into the platform annually. And partners can provide participant data either at the unit record level, which is participant by participant, or at the aggregate level as a total. And we did take a really flexible approach with the metrics and gave options, like Sandy said. So validated instruments that were really accessible because they were free or almost free. But if that was too much of a sort of starting point for some partners, Sandy adapted a question from one of those validated tools for each outcome. And then also we accepted partners' own data, or if they had a proxy for that particular outcome. And I think Zoe would be a good case of that. So if they're already collecting that, we just accepted that and rolled it in. And so then from this data, each partner has a dashboard that visualizes it. And then we have a portfolio level dashboard that visualizes it at the group level. And partners can share their dashboards with each other. And then everyone can see that overarching portfolio level dashboard.
Thanks, Emily. Shelley, now I'd like to hear a little bit about our work in terms of operationalizing it. 14 partners, 73 metrics, 12 outcomes. It's quite a lot. How do we operationalize it with this complexity?
There's actually 109 plus 73 metrics.
A lot. So needed to think of the project like a puzzle, and what's that picture? Like, what do we want it to look like at the end? And then break the project into those puzzle pieces so that we could really understand and manage those in smaller components that made sense. So we engaged the partners early in this process, and co-design was really important when we were coming to looking at the data contribution. So one example of those puzzle pieces is the partners' participants. We collaborated with Emily and her team to understand what they wanted to measure. For example, it wasn't just the number of participants engaged across a portfolio, but what cohorts these participants represented. We then worked with the partners to understand the individual systems and current reporting structures. These workshops guided the decisions around the demographics that we requested from each partner, with the partners given set values to select for each demographic type. So consistency in naming conventions is a very simple but important step when we start to think about aggregation and how we can get a portfolio view. Following on from the work that FTG and Social Outcomes undertook with the partners with their Choose Your Own Adventure, another piece of the puzzle involved looking at those metrics and their selections, the data they already had as their baseline and their targets, and using this to help design the templates for collecting that outcomes data as well. So we had a range of contribution items that we're requesting around finance, participant, stakeholder, and outcomes. And once we had developed these templates, a number of the partners participated in a user testing phase to provide feedback and ensure that those, what we had designed would work for them. And through the whole journey, it's been really important to work closely with the partners. And it is one of my favorite parts about this project. It's really enjoyable. They're all doing like such amazing work. So I'm lucky to get to, meet them all. And then, as Emily said, we've got the dashboard. So to then interpret each of their contributions in a portfolio manner, we came up with a consistent design structure that applied across each of the dashboards, that the structure allowed space for qualitative components. With the huge variations in the types of metrics and samples collected across the partners, it was really important for transparency and to remove assumptions about what the data was showing, that we had this commentary and methodology information.
So Shelley, we've had a lot of conversations with Emily, the partners, Sandy, about making it even easier going forward. How are we going to do that?
I think, Sandy, you were saying it really well earlier. It's about that simplification and what do we really need. So not collecting everything just because we can. So initially, we collected the demographic data in a way that grouped the participants by multiple categories. So, for example, we had delivery method by state. But on reflection, the value of this data breakdown didn't exceed the administrative burden of collecting the data in that way. So we've redesigned those templates, and it'll be much easier and quicker for the partners next year. So it's really an evolving process, and we're learning together and really trying to make it simple, but including that depth and that robustness that Sandy referred to.
Thank you so much, Shelley. And thank you for all of your work, because it's very exciting to see it all come together. And I think Emily will talk about the impact report in a moment. Angus is running through the dashboard. This is the portfolio level dashboard. This is de-identified, so that we are able to show you some of this. Emily, do you want to talk a little bit about some of the key important elements from your perspective, what you wanted to see? I mean, right now we're looking at the total reach, a pretty important piece. Do you want to comment on any of these from your perspective?
Yeah, so I guess we wanted to ultimately be able to measure impact, but that, is not like a 1-year task. So it's sort of an incremental build up over time, and alongside that sort of ambitious goal is, the sort of reach and the output type stuff, and who the participants are, etc. But I guess I see so much value just in understanding that, which that kind of wasn't my main aim in the beginning, but even that idea that those partners together have reached 5.3 million young people, and there may be crossover because some of them are online. It's really valuable to understand that. What's really valuable, something we actually didn't know, is the gender balance that was in there. That was surprising that we could see in that first year, a really strong skew to young women. So, I mean, we hadn't picked that up in our due diligence. So that was really enlightening. There's, I think what we were trying to do is find that balance between being able to tell a number and reach and meaningful human story. And I think we're still getting there.
Yeah.
As Shelley said, there's been quite a few fierce learnings already, but there's fascinating insights like this one here that you can see on the right side, expenditure by source. That the dark blue line, the dark blue bar, which is almost the main expenditure item for all the partners, is employment costs. So this is a small group, but it's a proxy for how small to medium-sized nonprofits do their work. It's through employing people. And, that kind of data is really important for movements like Pay What It Takes, look at overheads in a different way. So you can see even by collecting sort of basic financial data that's available on the ACNC, and you put it together, you can tell a story and you can advocate with that. Anyway, I'm going on, so I can't remember what your question was, Christy.
No, that's good. Actually, if you don't mind going back to the financial metric as well, one thing that I found quite a bit further up, please, Angus. Yeah, one thing that I think I found interesting was, I think part of FGG's approach is for their partners to be able to seek further support and capacity building funding outside of FGG, one of the strategies. And this for me was a really interesting insight, Emily. Do you want to?
Yeah. So, we're tracking what percentage of each partner's income do we represent. And we started out with the aim to be no more than 25% of any partner's income. But, they start out as guides, and we made a couple of exceptions. But we can see already in the first year, we've seen the percentage of income represented by FGG decline, even though we actually gave the partners less money in the second year than we did in the first year. The quirks of our model, how it works. So we can already, we can see that in that circumstance, they're doing well,
Yeah.
if that makes sense.
Yeah. Just real quick, we'll go down to the outcomes data. This is interesting as well because we're looking at the different components of the outcomes data. Anything you wanted to comment on this, Emily?
Yeah, so I think this is a sort of very snapshot version of the outcomes. And because it was the first year and we had partners coming in, some had a baseline which we could see change. Some were using pre-post sort of questionnaires to assess change. Others had never collected this data before. So it wasn't a level playing field. So in the first year, we're sort of trying to understand who can show improvement and who's established their baseline, and then how close were they to their target. So that's what those bars are. So we were looking also how what partners wanted to achieve. So they set their own targets for that year. But of course, there's a lot of variability in that because some partners had stretch goals, some partners didn't have stretch goals. So it's not a way you can compare, but it tells us something as well, I guess.
Yeah, great. Thank you. Let's quickly go to one of the partner dashboards. And Zoe, I'm really keen for your perspective on this and how this has been useful for you. Do you want to just tell us a little bit about this?
Yeah, sure. Did you want me to contextualize a little bit
That'd be
on what
great.
Sandy elaborated? Yeah, so for those that don't know, our organisation Happy Paws, Happy Hearts, we are in, as Sandy mentioned, the gateway area. We are working with young people who are isolated in homes or in group homes and the like, and we are bringing them out often for the first time. And some of our young people haven't left those homes for many years before they come to a program. And the programs are really engaging in themselves because they use rescue animals. And we have partners with the RSPCA and other animal welfare organisations, and partners that are working with different types of animals, not just dogs, but cats and farmyard and wildlife. We were working with some goats in the last couple of weeks. So an engaging way to draw young people out of socially isolating circumstances and then gateway them through social inclusion programs, but then, the ultimate outcomes, of course, is if they find those pathways onto independence or volunteering and education, as well as employment and traineeships across the board. So it's very, the journeys of our young people can vary. As Sandy said, for some it takes many years. For some it can be, shorter. It just depends what risk factors they come in with. And we're really trying to, I guess, build their resourcefulness. We talk a lot about young people in terms of, they just need to be more resilient and things like that. Well, resilience is resourcefulness. What do you have within you and what do you have in your network? And we're building on both of those things. Where is the purpose piece for them? Where is the skills building? Where do they find that confidence? And the beautiful thing about our work is that the animals really highlight to them. They're very capable. They can learn. They're having a big impact for the animals. Distilling that all down and matching it with data and making sure that we're telling that story backed by data is, of course, something that anyone would grapple with. We were very fortunate to work with Sandy's team before we actually were with Future Generation Global, and so we had a theory of change. We actually had selected a tool that we were using to measure, which you can see there, the outcome star, which we found to be a really important change for our organisation. I had tried myself and quite openly admit that we had failed by using more academic tools because I could see my participants kind of recalling back as we presented more academic and really quite medical tools to them, because of course we're a space away from that. So we found the outcomes star to be non-invasive, and it's also quite flexible, not just for Future Generation Global, but a whole number of our different funders. We are able to, kind of map it to other things so that they can do these views that they're looking for. And that was one of the great things that we were able to do with Future Generation Global and with the team there. Christy, is just sort of kind of go, okay, what are the bits here that we're already measuring that can match, and then start to help tell the story, not just of us, but for the overall portfolio view.
Yeah, that's really interesting. And I think I'm in the conversations we've had about the gathering of the data, I think that through FGG, some of the data that you weren't gathering previously has started to become important to your impact story. So what has that meant to your organization, and, you know, including apprehensions?
Yeah, we really had apprehensions, and I really appreciate the support we had in that co-design. And that's because we had, you know, quite honestly been burnt before in funding relationships where we're trying to explain the uniqueness of our work. We're trying to explain that some of our young people have access to the ability to take their own journey at their own pace. For example, you know, our neurodiverse participants that have NDIS funding, that journey can take as long as it takes. But for some others, such as our youth at risk and coming through the youth justice programs, they might only have a short, you know, term-based funding block available to them. So they might come for a short-term program, and that's quite a different journey. And we were a bit concerned that, you know, even on a reach perspective, we had some hesitations as to whether or not we could capture truly our reach, because if you just take a snapshot on one day, our numbers of participants accessing program are subject to those short-term in and out, and we really wanted to make sure that that wasn't lost. And through this process, we've been able to really get a handle of that, and then make sure that we, you know, can communicate that not just internally but externally, so we can actually track now how big that reach is.
Yeah, so that's been really interesting, including, I suppose, some of the demographics that perhaps you weren't gathering before. So with the SEER work that's been enabled through FGG's impact measurement process, how have you been using that?
Yeah, so with the SEER work, I guess it's created the right level of rigor in our organisation. So as you said, we're collecting more things. We're able to still tell that story in more detail, and we really understand which parts of our tools speak to which parts of our theory of change. And so being able to leverage that, I mean, I can't speak to how many ways that kind of flows out into your organisation. I know Kel's on the line right now. She's our amazing Deputy CEO, but she called me yesterday just to say that, you know, we've picked up a new funder. We can't announce them yet, but the key feedback was that, you know, they just couldn't look away from how well we're able to articulate the outcomes that our programs are delivering. So that's the kind of flow and impact that you can't kind of see until you start to get that really clear feedback from others to say, yep, we can see that you really understand this very, very well. And it stands you out, I guess, above, you know, quite a competitive space in the grants land.
Yeah, that's fantastic, and congratulations. How exciting to your organization has been growing remarkably, and that is great news, really wonderful. So how's this process created the right type of approach for Happy Paws, Happy Hearts?
Yeah, look, I still think our approach is evolving. You know, you kind of called out some of the demographic work that we're doing, and we're really trying to balance what's, you know, to Sandy's point earlier, what's the right level of information to collect, because we also don't want to create barriers into our programs. We don't want to, and we have this conversation with lots of different stakeholders. You don't want to add, you know, extra things on entry into programs that might actually turn away someone who really needs the programs. So we're just trying to make sure that we're really conscious of that. I think that through, you know, this work with SEER and with FGG, the really important thing for organisation like ours is to stand really strong in what we know about ourselves, so that when we do sort of reach into a new area and we have a new funder on board to take us, you know, to new regions, and they're asking for particular data, we can say, look, we don't actually feel that that's necessary to tell you whether or or not we're achieving the outcomes that we promised. And I know that can be really hard when they're in control of the money on the other side and moving your programs forward. But it is really important to be able to stand strong and say, well, we've tested this and we've tested this, and we know our participant base, and we know that if we add too much of this, it's actually going to take away from our joint goals to make sure more youth are supported through programs.
That's awesome. So it's a very powerful way for you to be able to stand strong on your mission and vision and what you're wanting to achieve and work in partnership with your funders. That's awesome.
And all else fails, I ring up Sandy and I say, please, Sandy, will you attend a meeting with me with, this different body to explain why we're not going to over-engineer this?
So I've got some questions in the chat, but first I just want to go back to the presentation, Emily, and talk about the impact report.
Sure. So, yeah, we've just released our first impact report, which has, been enabled by that data, and that aims to tell that collective story of the portfolio of partners in a way that doesn't set them up to be compared. And most importantly, it tries to bring in the human stories alongside that, the numbers and the data. And it's definitely a version 1.0. As I mentioned, there's a lot of variation in where everyone came in. So, the first report shares what we've been able to measure, and it has established that consistent baseline going forward. And, we think if we, keep steady, keep collecting that information with the partners, that's going to grow into a really compelling asset that will help us advocate to governments and others about the value of investing in prevention and wellbeing, and also investing in the core operations and capacity development of high potential nonprofits. So you can, I think, Angus, send around the link if you would like to have a look at the impact report.
Thanks, Emily. So learnings and questions, and I've got some questions here. Key learnings from your perspective.
Yeah, so obviously it's a task for many. So the relationships between all of us are so important. With SEER, we're constantly trying to improve. We're constantly trying to make it more user-friendly, make it look better. So it does require ongoing resourcing. And some of the tensions have been mentioned. The big ones for me are doing the complexity and humanity of the partners' work justice, and also presenting it in a digestible way for different stakeholders that mightn't have these issues top of mind. And the second one is, finding that balance between rigor and what's reasonable to ask. And that Zoe mentioned that. So whatever we're asking, they're then asking our participants. So, the feedback loop, honestly, is so important. Practicalities, probably we would use a first year, if we were doing it again, use a first year to collect the consistent baseline. And there's a lot of fluidity between the short and medium term outcomes. So to simplify, we would probably collapse those together. And, we're not at the long term yet, but it's really clear already that the way some partners work, finding that evidence of the long-term impact won't be possible without a separate longitudinal approach, which of course they need to be interested in doing, and there has to be funds available for that.
Thanks, Emily. And from your perspective, Zoe, anything else from your learnings that you would like to share?
I just also wanted to call out to my amazing team, because we were also able to release our first impact report off the back of all this hard work. And it too, like Emily said of their impact report, it was a really beautiful way that we were able to showcase not just stories, but also the data behind. And so I'm really proud as to where the organisation's at and how competently we can present across all the different areas that we work.
Thanks, Zoe. I'm going to try to get to some of these questions, but before I do, I think the big learning for us is how do we make it easier to bring data into the platform when we're considering lots of different systems, lots of metrics, lots of outcomes. And so we're really pleased to be able to, big reveal, announce that through our partnership with 8Wire, as a terrific organisation, that a technology partner that we're working with, we now have a connector that will automatically connect into more than 30 systems with once it's set up, to be able to pull out the parts of the data that are relevant. And what is exciting about this is that, you know, this was one of the first questions Emily asked me. You know, can we hook into those systems to make it easier? And so at that time, we were still in the design phase of what this, how to data activate this impact measurement framework. Now we can say with confidence, we do have that capability to do that through our partners. And we're really delighted to be able to offer that as part of the platform, which I think means that, you know, it will, once impact measurement frameworks are established, portfolio impact measurement will be much easier and less arduous for not-for-profit partners if there's a willingness and an interest to do automation around this. And so that's very exciting, and we're delighted to be able to offer that. And so, you know, our work is about data activation across a number of example use cases, and impact measurement is one that we're working with a lot. We're proud to be part of this collaboration with FGG. We're proud to be also gathering data for outcomes measurement in different contexts, including with Stronger Places, Stronger People, the Department of Social Services, and a number of other government and philanthropic partners and individual not-for-profit organisations, some of whom are here today. So thank you very much, everyone. So now let me just see if I can quickly get to some questions, and if not, we will aim to also send out some responses to these questions. So Emily, there was a question here. How are you enabling your partner orgs to effectively collect and manage the data they're reporting? Are you funding the capacity building of those organisations for that?
Yeah, so our funding is untied. So basically, we have a conversation with partners about what their priorities are and how they want to direct that money. So that, you know, that would go for the full gamut of operations as well as, you know, organizational capacity development. We do have a sort of a pot for capacity development, and each of the partners has nominated their priorities for that. So that could, one of the main ones that is selected, I think 43% is data management and data and impact reporting. So yes, absolutely, we try and support the resourcing required for the partners that need that.
There's a question here too, Emily, from Amy around the funding range for the 14 partners. Is that something you can share?
Yep. So depending on the size of the organisation, partners receive, I think in the first year it was between about 200 and 600,000 per annum. It was a bit less in the second year because it depends on our funds under management. But I think the range, you know, was consistent. I think it's kind of between 150 and 200 for smaller organisations and 400 and 600 for larger organisations.
Thanks, Emily. Sandy, great question here from Jai. Can you give examples of the variables that were common across the partners and how you meshed measurement across their diversity? What are the actual data points that are measured, and how was that shared?
Short answer, no, because it's 101. That's an hour conversation because it was complex. But we had those four clusters. So the way to think about it was grouping. So how do you group into those four types of organizations in terms of how they engage with whom? And then saying, if you do that, what's the likely outcome that the evidence tells us is likely to accrue from that kind of activity? And they could pick from a couple of outcomes. So we really use the evidence base. And Emily, we did like weeks and weeks and weeks of work together on articulating that evidence base and then working out how it fed into both the theory of change and the measurement framework to make sure that we could get those groupings right, the outcomes right, but there was still that variability that people could say, yep, that one feels closest to what we do. So we tried to give 3 or 4 options for each one that they could pick, but the most important thing was to group them in the first instance. That allowed us then to tease out what the outcomes would be in the short to medium and long term for each of those activity types.
Thank you, Sandy.
And there's actually an appendix in the outcomes report that has each individual metric. So, the body of the report is the sort of aggregated outcomes around the different groupings that Sandy's mentioned, but at the back, so you can actually see, well, what does that mean in terms of what are they asking and what's the result? They're all included there. So you can see how we've put that together.
Thank you, Emily, and thank you, Sandy. And it's past time. We do need to finish up. Thank you, everybody, for joining us. I appreciate your time very much. All the partners, once again, incredible work. Zoe, have a wonderful holiday, and thank you for being here with us. Thank you, Shelley. And again, thanks, everyone. This is recorded, so we'll send that out along with the resources and some of the public links that you can see, the dashboards. Thanks, everybody, for your time, and catch up with you later.